pelvic pain after ejaculation is not normal, and it's not just in your head. I am not a sex therapist. This is all about dysfunctional patterns of movement leading to pelvic instability, affecting, in this case, sexual performance. You see, here's the pelvis, and inside your pelvis, you can see all these muscles, you can see the joints, you can see the bones. Inside this resides your intestine in the back, your bladder in the front, and prostate in the middle. When these muscles are tight, they can impose on the prostate, they can impose on your sexual organs and whatever is connected to it, from the source to the outside, and so it can impact its performance. This video is reviewing those things and what is most likely taking place. In the absence of infection or other medical findings, the issue with ejaculation or pain, pelvic pain after ejaculation, is a symptom of pelvic floor dysfunction, nerve irritation, or tension patterns. Understanding what happens during and after ejaculation allows me to better understand the extent of what is happening here. When I look at these problems and when patients come here, I look at things from stability point of view. I want to see, is this pelvis stable or not? So every single thing that the patient reports to me allows me to see the location or the vicinity of what is happening, and then I have to understand and see what exactly led to that. The muscles inside your pelvis work with the surrounding area to stabilize your pelvis. Your pelvis, it has spine that's attached to it and lower extremities that are attached to the bottom. Lack of stability in those areas lead to pelvic instability. And pelvic instability is a disastrous event. Your pelvis is the foundation to the structure above, and if the foundation is unstable, the structure above is compromised. You are the structure above and the pelvis. Your upper and lower extremities, you can live without, not fun, but you can still live without them. You have double reinforcement of the walls of this pelvis with the muscles on the inside working on the outside. When the stability on the outside is not happening, the muscles on the inside have to behave differently. They have to provide more. And that leads to tension, that leads to weakness, that leads to lack of performance, that leads to irritation and imposition on whatever resides here. Other than pelvic organs, we have nerves, we have arteries, we have blood vessels, veins as well. Of course, muscles, joints, ligaments, bones are part of it. Stress in men can also lead to or contribute to tension of these muscles. I am convinced that in women, while we hold our tension in the neck and upper back and sometimes in the pelvis, in men it's primarily there. So we want to look at this holistically. It's not just an infection. It is not just some kind of a disease that is leading to this. In the absence of those, we want to go all the way to the root cause. We want to go to functionality. We want to go to the mechanics of movement here. Some of the signs and symptoms of these issues that you may not be related to ejaculation or pain after or during ejaculation that you may think of are pain with sitting or bowel movements. You can have testicular pain or perineal pain. Perineum is that part of your body that is in front of your anus and behind the base of the penis. Perineum holds the internal organs in place, and it holds the sphincters. When you use the perineum in movements, when you clench your butt, when you're working out and you feel that tension, that golf ball sensation in the perineum, when you feel that burning sensation there, that pulling of the muscles there, or that tissue there, when you catch yourself clenching your butt even when you're walking or when you're standing, when you're holding your breath, when you have chronic lower back pain, when you have hip mobility issues, when you have chronic sacroiliac joint pain, these are all different chapters of the book Pelvic Floor Dysfunction, with or without issues with ejaculation. So if you're a young individual and you go report this and you see a urologist, they're going to test you for infection. They're going to give you antibiotics, even though the test may not be there. They may test you for different things, and then they throw their hands up in the air and say, oh, I don't know, go see a pelvic floor therapist. And then you go see a pelvic floor therapist, and a high majority go in through the anus to try to relax these muscles. Well, frankly, with all due respect, if that was the only way these muscles would be conditioned, you would have a finger there. And we know that's not the case. So you want to provide the environment that this body thrives in. So what do we do to begin that process? We start with biological breathing, because that's how your body conditions these muscles to relax, to perform, to oxygenate, to strengthen. When you breathe biologically, you have to have certain postural presentation. By the way, if you don't know what biological breathing is, don't worry, I'll put it at the end of this video, but make sure you subscribe to my channel. If you're watching this and you know someone with similar problems, please forward this video to them. There are things you can do, and there are things you can learn so you can do for the rest of your life. You can't keep seeing different providers for part treatments. You need to understand the concept, and it's a very simple to understand process. So you do biological breathing and you use developmental exercises, the same exercises that stabilize your pelvis, stabilize your trunk, allowed you to move functionally. That's the manual of movement that you need to understand. Every manual has a troubleshooting section, and your problem is what the topic of this video is. You go to the manual to solve the problem. Simple as that. If you have not subscribed to the channel, please make sure you do. If you need help, contact my office. I can look into it and see if there's something I can help you with. Until next time, take care.